Hi guys, welcome back to my channel. My name is Lola. Today, as you have seen from the topic, we'll be discussing about the causes of fever in children and what to do when you notice your child has a fever. First of all, what you are going to do as a mother, you're supposed to get a thermometer. Yes, a thermometer. When you have your thermometer, you'll be able to measure the temperature of your child at every given time you notice they have a fever. It's not just enough for you to touch their body and feel it's warm and you conclude they have a fever. No, there should be a means to measure the temperature for you to be accurate, to know that this is really fever. And you can easily get thermometer in the drugstore, in the pharmacy, and maybe some shopping mall. You can get your thermometer. So now let's dive right into the video. What is fever? Fever is a slight or raise in body temperature. A slight raise in body temperature, a body temperature that's above normal. And for you to know that this temperature is above normal, you need to know what the normal temperature is. And normal temperature for children, even adults, is from 36.5 degrees Celsius up to 37.5 degrees Celsius. Anything above 37.5 degrees Celsius is already fever. So when you measure your child's temperature and you feel this, you saw that this temperature is above 37.5 degrees Celsius, you need to act fast, because high fever or continual high fever can lead to brain damage. So you can't leave your child with fever. It has to be treated immediately. And most times fever is really a good sign, because it tells you that the body is trying to fight something. The body is trying to fight an infection. You just don't have fever if there's no cause. There is a particular cause for this fever. So it's actually good that the body is showing you a sign that there is something going on in this body, and which brings about this fever. So when you notice your child has a fever, you take your thermometer and you measure this temperature and it's above 37.5. You need to act fast. And one of the things you should do first is you need to start tepid sponging that child, because if you don't tepid sponge, the fever can keep going higher, which is very dangerous for the child. So you get your warm water in a bowl with a cotton piece of cloth. You put the cotton piece of cloth into the warm water, you squeeze out excessive water, and you begin to touch the child all over the body. When you notice that a piece of cloth is so hot or warm, you dip it again inside that warm water and you continue the process. You don't use cold water. And another thing you can do is to on the fan for the child and open nearby closed windows. Then you loosen any tight clothing the child is wearing. And after doing all of this, and after some minutes the fever is not going down, you keep measuring with your thermometer, and after some few minutes this fever is not going down, you need to take your child to the hospital for them to ascertain the cause of this fever, because the fever does not just come, it has a cause. So you should take your child to the hospital for the cause to be ascertained. And another thing that can cause fever in children, it can be bacterial infection, it can be virus infection, it can be ear infection, which is either caused by virus or bacteria also. So, and it can also be maybe some kind of tonsillitis, or some kind of maybe teething. Though teething causes a slight raise in body temperature, it does not really cause a type of fever that is a cause for alarm. So it just really raises the body temperature a bit. So you need to go to the hospital for it to be ascertained. Is it teething? Is it ear infection? Is it tonsillitis or any other form of infection? Sometimes it can be malaria also, or typhoid fever. So you need to go to the hospital for the cause to be known. And on your way to the hospital, you just don't stop tepid sponging, especially when the temperature does not comes down. You need to keep tepid sponging, especially if the hospital is very far from where you live. You need to keep tepid sponging. And in addition to tepid sponging, you can give any antibiotic to help reduce the fever, because leaving your child with high fever is not going to do any good. It's very dangerous. So you can just give any antibiotic in order to reduce the fever. Antibiotic like paracetamol, you can give that for you to get to the hospital, and the doctors and the nurses will take charge of that child. So I hope this video has helped somebody. If you have any comments, any question, you should ask in the comment section. Please subscribe to my channel, and I'll see you in my next video. Bye.